Hello everyone, and welcome back to my channel. My name is Dr. Stephen Roth, and I'm a board-certified oral and maxillofacial pathologist. Recently, in the news, a new boogeyman has emerged. In fact, you may have even seen news bulletins like this one. Ozempic mouth, shocking new side effect. In fact, what inspired this video is that just today I received a media request asking me to comment on this new serious condition. I figured, why not share my thoughts with all of you instead? But first, just a quick disclaimer that all opinions expressed in this video are mine and mine alone and do not represent any organization that may employ me or that I may belong to, and that this video is for educational purposes only and should not serve as medical advice. Should you have any questions or concerns about your oral or systemic health, please see your nearest oral or systemic healthcare provider. Ozempic and other GLP-1 medications act by increasing insulin secretion, lowering blood sugar, as well as slowing gastric movements. This makes you feel more full and have less of an appetite. What initially began as a medication for diabetes has increasingly been used for weight loss. In fact, I was even on a GLP-1 medication for weight loss and had great results until my insurance would no longer cover the medication. Ozempic mouth, according to these publications, presents as mouth dryness and an increase in periodontal and teeth complications secondary to the xerostomia. However, it's important to note that dry mouth, aka xerostomia, is the #1 side effect of all prescription medications. So this isn't much of a surprise. Perhaps it wasn't first reported because patients with diabetes have dry mouth due to their diabetes and have increased incidence of periodontal disease, again, due to their diabetes. So the side effects of these medications may not have been readily observable before. However, now that an increasing number of people without diabetes are taking these medications and may not be on quite as many other prescription medications, a typical medication-induced xerostomia is being noticed. My experience, both as a provider and a patient, this is nothing crazy. I've seen many patients on GLP-1s for weight loss, and xerostomia is by no means extreme. In fact, I would say that I observe far more severe xerostomia in patients on antidepressant, anti-anxiety, and other antipsychotic medications or on certain blood pressure medications. In my own experience, I didn't really notice that my mouth was especially dry when I was taking these medications and haven't noticed much of a difference or increase since stopping. So my thought is that this is just overblown media sensationalization. Xerostomia is an expected side effect when taking most prescriptions. It's not the boogeyman that the news wants you to believe it to be. Yes, it is inconvenient, and yes, it can have effects on susceptibility to gingivitis and periodontitis, as well as cavities, but it isn't much different from any other prescription medication. One thing that probably is a little different than other prescription medications is halitosis, or bad breath. This side effect can occur on patients in ketoacidosis. Ketoacidosis occurs when the body starts breaking down fat for fuel, the desired effect of these medications. This results in the production of chemicals called ketones. These ketones accumulate in the blood and are exhaled through the breath, giving it a very distinctive, sweet, fruity odor, often described as resembling nail polish remover or acetone. And yes, ketoacidosis can indeed lead to dry mouth as well. All this to say, I think this whole Ozempic mouth thing is overblown. I think it's important for patients to know that dry mouth is a side effect of this medication, but as long as they're counseled well and taking care of their oral health, it shouldn't really provide any extreme barriers or prevent anyone from taking this medication. Of course, always discuss your concerns about any of your medications with your prescribing provider. One effect that has been reported that I do believe to be significant is something called Ozempic face. This is a characteristic facial appearance of hollowed out cheeks and pronounced facial bones with possible wrinkling and loose skin. On both sides of the face, we have two large collections of fat called the buccal fat pads. Because patients on GLP-1 are using fat for energy, these fat pads, as well as other areas of fat on the face, including surrounding the eyes, begins to shrink. This leads to these reported changes. The loose skin of Ozempic face is due to the rapidity or quickness of the weight loss, as the skin doesn't have sufficient time to tighten as the fat is lost rapidly. This Ozempic face isn't exclusive to patients using GLP-1 medications, but can also be seen in other rapid weight loss patients, including those receiving bariatric surgery or even patients that choose to have portions of their buccal fat pads surgically removed. All this to say that GLP-1 medications provide a lot of benefits to patients, but of course, like just about all medications, have side effects. As more people use these medications, we will continue to learn more about them, but be very careful with what you read in the media, as sometimes these side effects aren't as scary or as serious as they're made out to be. Of course, again, always discuss your concerns about any of your medications with your prescribing provider. Thanks for watching this video. I hope that you found it informative, and if you did, be sure to share it with someone else that may find it helpful as well. Please subscribe and like the video if you haven't done so already. And of course, as always, be well.